Hey everybody, it's Dr. Mexico back again with your healthy tip for the day. This is going to be an important one, a really important one. So do me a favor and bear with me and listen closely. Today I want to talk to you all about the mystery of disease. We all know someone, or you may in fact be watching this and this may be true for yourself. We all know someone who seemingly developed this mysterious disease. And what I mean by that is, one day we were healthy, and then the next day we went to our doctors and we received a diagnosis. And we went somehow from being completely healthy the day before to having a disease the next day. And I use the term the mystery of disease because that's the term that my close personal friend and nutrition mentor, Dr. David Seaman is the author of the Deflamed Diet. He uses the term the mystery of disease to explain this phenomenon of what we also refer to in medicine as idiopathic disease, which means from an unknown origin. We don't know where it came from. So most of us know somebody like that, or maybe we've experienced that ourselves, where yesterday we were completely healthy, and then today, oh wow, I'm sick. And it's staggering how many diseases have a mysterious origin. Well, I'm here to let you know, I'm here to summarize a chapter out of the Deflamed Diet, where Dr. Seaman talks about the mystery of disease and how it's not actually a mystery whatsoever for many diseases, but rather it's the pursuit of disease. We're actually actively pursuing these diseases. So we really only ever, even when we're classically medically trained, or from a general standpoint, we really only consider disease from the outwardmost portion of the disease. That is the disease itself. We don't even consider what events led up to causing the disease. So we're basically classically trained and we're indoctrinated to believe that diseases just kind of appear. They mysteriously appear out of thin air, or that somehow we're attacked by these diseases, or that somehow, we're invaded by aliens in the middle of the night and they give us this disease. And then when we ask your doc, how did I get this disease? The response oftentimes is, no, we don't know. It's idiopathic. It just kind of happens. Well, I'm here to tell you it doesn't just kind of happen for many diseases. So bear with me. This is going to be it's going to be straightforward, and I want you to just pay attention though as I go over these diagrams and I explain to you really the 4 stages of pursuit of disease. And you're going to quickly learn that it's not really a mystery at all, but an active pursuit. Okay? Watch these diagrams as I show them to you. So here's one. First one that we look at is called the mystery of disease. So again, you see all of these diseases kind of centered around this hollow space, kind of as if they're just coming out of nowhere, right? And you see high blood pressure, heart disease, type 2 diabetes, gallbladder disease, liver disease, infertility, prostate disease, erectile dysfunction, cancer, autoimmune disease, inflammatory bowel disease, interstitial cystitis, macular degeneration, depression, irritable bowel, dysmenorrhea, endometriosis, asthma, acne, sinusitis, cold, flu, Alzheimer's, Parkinson's disease, osteoporosis, chronic fatigue, fibromyalgia, pain. All of these diseases are not a mystery of where they come from. Right? They're actively pursued by us. But when you think of them in isolation like this, you're left wondering, well, I went to my doctor's yesterday, I was fine, and then all of a sudden I have high blood pressure today. I didn't have it yesterday, but somehow I have it today. You had it yesterday, and you were pursuing it for a long time. Now let's consider this next slide. This next slide is the pursuit of disease. And it actually shows the 4-stage process by which these diseases occur. If you look at stage 1 in the middle, you see the word or the term pro-inflammatory diet and lifestyle. So at the beginning of all of those diseases that I just mentioned to you, they all start by living a pro-inflammatory lifestyle. Now, pro-inflammatory lifestyle for a long time is asymptomatic. We don't really notice any symptoms of it until we reach the point of no return when it comes to inflammation, and then our inflammatory cup essentially starts to spill over. And then we start to have symptoms. So stage 1 of this disease, the pursuit of disease, is living a pro-inflammatory lifestyle. Stage 2, if you look at that outer rim there, you see a lot of fancy acronyms that to most people watching this, you don't have to understand what those acronyms mean at all. But for my medical colleagues who are watching this, you want to learn more about anti-inflammatory nutrition. So some of these are going to look familiar to you. You're going to see this NF-KB, that stands for nuclear factor kappa B. You see interleukin 1 or IL-1, interleukin 6, TNF is tumor necrosis factor, LTB4 is leukotriene B4, PGE2 is prostaglandin E2, then you have thromboxanes, and other pro-inflammatory prostaglandins, eicosanoids, autocoids. These are pro-inflammatory chemicals that are at a subclinical level, meaning you don't feel them, you don't know that you're having this pro-inflammatory state starting, but it's starting, and that starts in stage 2 of this pursuit of disease. And these all come from eating inflammatory foods. Then you get to stage 3, and this is when we start to notice some quantifiable, measurable, and actually visual changes to our body that starts to indicate that our pursuit for disease ultimately is going to be successful. We're really trying hard to get to the disease. We don't know that we're trying so hard to get there, but we're actually succeeding in our pursuit. And this is when you start to notice BP, or your blood pressure starts to go up. Your waist starts to get larger. Your blood chemistry lipid count gets all out of whack, and it gets to a more unhealthy state. Your sugar level goes up. Your hemoglobin A1C level becomes that of a diabetic or pre-diabetic. Your BMI, or your body mass index, starts to reflect that you're either overweight or obese. Your hip to waist ratio gets thrown out of whack. You also see vitamin D there and HSCRP. But this is essentially you're pursuing poor health. These are measurable, documented signs of your inflammatory pursuit of your disease. We can start seeing them now. But you don't necessarily have the stage 4, the outside portion, which is the diseases that we mentioned at the beginning. But if you continue in stage 3 long enough, you're ultimately going to end up with one of those diseases in stage 4, whichever disease is in your genetic predisposition to exhibit. So I hope by dissecting these diagrams the way that I did, I can show you that you're not an innocent victim who is somehow just attacked by aliens in the middle of the night and ended up with high blood pressure or whatever the disease that you have is, diabetes or any of the number of diseases that I mentioned at the beginning of this. Unfortunately, we are unwilling, well, we're willingly, but we're unknowingly pursuing these diseases with our pro-inflammatory lifestyle choices. So they don't come out of thin air, most of these diseases. They are not idiopathic. They're only idiopathic in that they're not known to the person who's telling you. But there's a known driver for these diseases, and for many of them, there's a definitive link to chronic inflammation from the foods that we choose to consume. Hopefully this puts the mystery of disease into perception for many of you, or it helps you understand that it's really not a mystery. We know where it's coming from, but it's an active choice for you to change the drivers of these diseases. This is your healthy tip for the day. This is Dr. Mexico. Make it a great day.